Hi, I'm Dr. Juan Carlos Millon, and I'm a pediatrician affiliated to the Top Line MD Alliance. I'm here today to talk to you guys about the human papillomavirus vaccine and human papillomavirus. So, what is human papillomavirus? Human papillomavirus is actually the most common sexually transmitted infection, or STI, in the United States. The human papillomavirus vaccine has been out for about 12 years. Has been very effective in reducing the infections of HPV in both men and women. And because of that, hopefully in the near future, we're going to start seeing reductions in cancers such as cervical cancer and oropharyngeal cancers. So if this is a sexually transmitted infection, why are we giving it to our children so young? Well, there have been studies looking at the onset of sexual encounters after the HPV vaccine, and it is no different than without the HPV vaccine. So by giving the vaccination, you are not encouraging your adolescent to engage in sexual behaviors. We also want to prevent this infection before there's any exposure. So just like the hepatitis B vaccine will prevent hepatitis B infection in the adolescent period of time, same thing we're doing here with the HPV vaccine. We are going to prevent this infection before there's any type of exposure to your child. So what is the schedule? When do we give this vaccine? So we usually give this vaccine at the 11 or the 12-year-old checkup. The vaccine is licensed as young as 9 years old and as old as 46 years of age. Again, 11 and 12-year-olds is the target group that we aim to administer the vaccine, but it can be given at any point after that. There are two different dose schedules depending on the age that the vaccine is first given. So if you get the vaccine before you are 15 years of age, you will get a 2-dose series 6 months apart. If you get your first vaccine after you're 15 years old, you will get a 3-dose series. First, the initial dose, then 2 months later, and then a minimum of 6 months later. The most common side effects of this vaccine are, like any other, local reactions at the site of the injection, maybe a little bit of redness, a little bit of fever, maybe malaise. And very rarely in the initial studies, we saw a little bit of syncope, which means passing out at the time of the injection. It was hard to tease out if this was due to the injection itself, since this is an uncommon symptom that we saw in some of the other vaccines given at this age group. So in summary, I encourage all of you parents to think about protecting your children with the first vaccine that we have that will protect against a certain type of cancer. If you have any further questions, please contact your Top Line MD affiliated pediatrician. Give them a call, go into their website, make an appointment at your next visit, and ask, how can I protect my child against cancer? I've heard about the HPV vaccine. Take care. This is Dr. Millon.